we're going to get you up and about and moving in the next session. So I realise we've spent the morning and we've been sitting at the tables and we've been taking a lot of information. I am going to introduce you to Steph Bannister. Now, Steph is a person who thinks about things differently from you and me and most of the other people in the world, and that's because he has a view of how you design things that are sustainable and effective in a way that you don't normally think things through. Because how many of us are just working through processes that we've been given, or that was the norm of my organisation, apparently I'm not allowed to change anything, or actually, this actually just allows people to keep doing what they're doing because, you know what, people tend to be a bit scared of change. So, we're about being change agents, and Steph is going to be your guide this afternoon. He's going to get you up and around and your blood moving so that at 3:30, none of you have got that sugar crash really affecting you. So, without further ado, we are going to ask Steph one question. So, Steph, everyone who's got up here today has been asked what their superpower, and the room is dying to find out what yours is.
I think if I'm good at one thing, then it's being comfortable with being uncomfortable, which is a good skill for a designer because half the time, frankly, we're not entirely sure what we're doing. We're really feeling our way out. So, yeah, comfortable with being uncomfortable.
I would love to see all the nurses in the room actually ask that question of a patient just to see what the look in their faces were. Are you comfortable with being uncomfortable? Yes, I think anyone who's been a vaccination nurse, you'd know what we're talking about there with the needle thing as well. So I'm going to let Steph guide you through this afternoon. He's going to have you up and around. We're going to be fairly interactive with this. And we're even going to get a couple of roaming mics in here to actually help some of the discussion that Steph will be leading a bit further on. So I'll hand over now. And Steph, welcome to today.
Great. Well, thanks for having me, everyone. I'm not sure how much background you've been given on this session today, but we'll basically be going through a very rapid design process. So the whole thing is going to be a bit of a sprint. But we've got a couple of objectives for the session today. We're going to explore the challenges that you experience in your day-to-day, as well as some solutions for them, and we're here to work together. As I said, we're going to be moving through a design process that I'll talk a little bit about in a moment, but it will be fast. We will be standing up. We'll be doing a lot of writing and drawing and things like that. So the onus is really going to be back on you guys. But I have been asked to give a little bit of an introduction to myself, and I thought that since we were working together, we could kick off with everyone introducing themselves, so you start to know who you're going to be working with in your groups. So I don't know if you're familiar with this concept of 3-tag introductions. It's pretty easy, and in fact, I think you could cheat with this and use the superpowers that you've all been exploring today as one of your tags. It goes something like this. You stand up, you say your name, and then you say 3 things that might sort of help define or identify you. So if I was going to go first, and I am, then my name is Steph Bannister. My superpower, as you know, is being somewhat comfortable, being uncomfortable. And other things are, I'm a designer, and I'm a big fan of 90s hip-hop. So 3 tags, really easy. As I said, I've been asked to give a little bit of a background to Human-Centred Design. Personally, I don't think it's that special. I think everyone here probably understands exactly what it's all about. Human-Centred Design just refers to putting people right in the middle of your decisions, of your inquiry, of your understanding of the decisions that you make as a result. Something I think everyone here understands perfectly already. As you probably also understand, it's really about curiosity and compassion. I am trying to understand people when I do this, and I'm trying to be curious about what they care about, what bothers them, what they want, what they don't want. The process itself can be summed up in this idea of generation and synthesis. Designers go out looking for as many problems as they can find, or when confronted with a problem, they look for as many possible solutions. There may well be the very one that we first thought of was the right one, but it's kind of a hallmark of our profession to go out there and keep looking. After that, though, there's a synthesis, which is a fancy word for just bringing it all together, looking for patterns, looking for themes, looking for things that seem to be reoccurring. It's a creative job, something that gets a little bit lost sometimes because we're working more and more with businesses, and I think that's rubbing off on the profession a little bit. But there's nothing mysterious about creativity. The best way I've heard that described is really just associative memory. So this idea that you go out, you find a whole lot of things, and then you make connections with a whole lot of things you already know. Some of us might be a little bit better at it naturally than others, but it's something that everybody does, everyone can do. So, I mean, I've been doing this for a long time, 20 years or something, so I'm somewhat good at it by now, I hope. But there's nothing special to human-centered design, is my broader point here. I worked with APNA a little while ago on some of the first round of thinking, what was being called then Nestle clinics, which I know some of you are aware of, and it has different names in different parts of the country and different parts of the world, because again, this is not a particularly new concept, but it's one that we're moving into and trying to understand. And so I worked with APNA, some of that, and again, in a nutshell, and I'm happy to talk about any of this stuff in more detail later, but very quickly, we went and spoke to a whole bunch of people. It was as simple as that to begin with. A lot of nurses, practice managers, and fortunately some GP doctors as well, and various people involved in the sector. It's just a matter of sitting with them, or getting on the phone, asking them a few questions, and then frankly, shutting up and listening to them tell their story. You do that enough times, you start to get a handle on what people are really thinking about and what they're really caring about. So I collected all of that sort of stuff up, and it was pretty clear that there were these four kind of pillars emerging. People were talking about stuff in each one of these sort of spaces: awareness, preparation, the actual day-to-day operation, and then the one that was sort of interesting at the end, because the first three kind of make sense. I mean, that's how we sort of do anything, right? You're aware of it, you get ready to do it, then you start doing it. But it was interesting to think about contributing to this idea later. So how do we share learning? How do we share data? There are all sorts of things that can start to sort of be collected under that pillar there when we start to think about that. So there was almost a full circle here, becoming aware of Nestle clinics as an option. Surprisingly, and perhaps unfortunately, a lot of people don't even realize in nursing that this is a thing that's starting to be explored. So how do we help them become aware? How do we help them understand? Not just nurses, but everyone who needs to be involved. This would include convincing GP practice managers that it's something worth considering. So all of that falls under the awareness sort of pillar. Preparation, of course, is everything that you need to do to get ready, and there's a lot to do. And at the moment, I understand a lot of it is sort of on nurses to understand. So what resources can be developed for them to help them understand what they need to do, what support can they have, who can help them. Again, it's not too hard to imagine what can start to fall into that category. The operation is the day-to-day stuff, and this is a little bit harder actually because not a lot of people, comparatively, are getting to do this day in and day out. Some are. There's some great examples of nurse-led clinics or nurse clinics, or choose your phrase here, that are already in operation and have been in operation for a long time. So it was great to see that, but it was still interesting to start to think about, well, actually, what does this mean to keep on running it? Everyone's been talking about awareness and preparation, getting ready for it. There wasn't a lot of discussion to begin with, or pre-thinking around what's it going to be like to do this day on day, month on month, year on year. Fortunately, we had some people that we could talk to. And then, as I said, contribution. After we do all of that, how do we start bringing it back in to inform each one of these pillars? So one thing that came out, I mean, there was a lot of stuff that emerged, and we sort of wrapped this up in a relatively simple report. But critically, and again, I don't think this is news to anyone here, there's no single way of doing this stuff. It's a complex situation. It's a fluid situation. It's highly dependent on a lot of different factors. The community, the practice, funding. It can happen in different spaces with different populations. You can focus on different chronic illness. And those are just a few of the most obvious ones. So it's a very fluid, ever-changing situation. So there's no single answer. So everyone wants a single answer, of course, because that's nice. And the government wanted replicable models, which is, again, totally understandable. What we realized, though, is we're not going to be able to just make a cookie-cutter approach to this stuff. So that's where the modular approach has come from. It's really just from that understanding that came from the community itself. Everyone was saying, well, we're doing it in different ways, depending on who we are and what we're facing. There were some commonalities that emerged. Everyone was thinking about physical space. Everyone was thinking about funding. Everyone needed to understand what kind of impact they wanted to have. Everyone needed to work with practice managers and doctors in a team-based approach. So there were these common factors, but they're all very dependent. So that's where, again, as I said, this modular approach came. We identified some of those common themes, and then we went out and said, well, how are people handling each one of these kind of modules? And we started to put together examples rather than a plan, rather than a definitive and directive way of doing this. We were able just to come up with different clinics being able to tell their story using these modules. But again, I'm hoping that this is not news to anybody, or even if it is, it kind of makes sense, because again, this is something that you guys are facing day in and day out already in various forms. So there's nothing special to human-centered design, and when we applied it to thinking about nursery clinics, we found out what people were already talking about, and it was kind of this modular approach in a nutshell. So again, if there's any questions about any of that sort of stuff, I'm very happy to talk about it after the session, but we've really got our work cut out for us now, so we'll keep going. So one of the elements of design, of a design process, as I said, is this kind of generative idea, like a very divergent range of thinking, and it's a rhythm that then converges again. So we go out, we find a bunch of problems, we find some way of grouping them and organizing them, so we bring them back, and we pick the ones that we really ought to be thinking about, then we go out and explore solutions again, and we'll be following that same basic convergent, divergent rhythm today. And the first thing that we're going to do is start exploring challenges. So these are the challenges that you face in your day-to-day role. These are your challenges. And what we're here to do today is to understand them and to share them, and then collectively come up with ways that we might start overcoming them. So on the table in front of you, there should be some packs of Post-it notes, some pens. Make sure everyone should have them. You may have to rip up those pads, the Post-it note pads, so you can share them around. Everyone should have a few in their hand, right? So we're going to try and keep this to around about 10 minutes. Right. Grab those pens that are in the middle. If you want, you can use those or the pens that you've already got. Okay, so here's what we're going to do. I'm going to need your attention for just a moment longer, and then we're going to start. The goal here is to generate as many challenges as possible. It's not about being selective at this point. Okay, the goal is as many as you can think of. So some prompts for doing that. Think about your day-to-day tasks. Think about seasonal stuff. How does your job change throughout the year? Are there special events? Are there sequences of events that you know about? How you have to interact with different people and their roles. What it's like to learn that yourself and gather the understanding that you need, and what it's like to try and communicate that understanding to other people, or anything. These are the challenges that you face doing your job. So 10 minutes, write down as many as you can on your own, one problem per Post-it note. Okay, one problem per Post-it note. 10 minutes, starting now. Any questions? Again, if I can have your attention, pay no attention to the time up there, because we're going to do this faster. Now, on the table, on each table, there should be these large pieces of paper. These ones, right? Be careful, because part of them are sticky. So you're going to have to open it up, put it down in the middle of the table. Make some room, because you're going to be putting your Post-it notes on there. You may well need to use more than one. So wonderful. So what we're doing here is a very, very fast version of my job. You go out, you find a bunch of problems, there's a pattern to them, but they come in as just a noise. They come in as just a mess, a cloud, and you have to sit with it for a little bit of time. We're not going to sit with it for any time, of course, because we're moving fast. And you look for these kinds of patterns. So one way of doing this, it's relatively easy, is would one person, anyone from each table, one person put their hand up from each table. Right? Okay, one person from this table, one person, please, hand up. Hand up. Okay, great. Grab one of your, grab the first problem. take your problem and share it with the group. And in fact, let me read through the instructions. They're pretty much like this, right? Working as a group, what you're going to do is the first person says, well, I have this challenge. Discuss it briefly, because again, we're moving fast. Now, other people will have experienced the same challenge. They may have written it in a different way. They may have phrased it differently, but they will be thinking about the same thing once you start to discuss it. So that first person says, well, I have this challenge. And you put it down on the piece of paper. Everyone who has a similar challenge also quickly now discusses it and puts it down next to that piece of paper. So what we're going to end up with, is probably several of these sheets with groups of like problems on them. So we're trying to, as it says up here, we're trying to cluster these challenges together. So don't just stick them down randomly. If one problem, all the similar problems in one corner, and then likewise. And keep going until you've gone through all of the challenges that you guys have got as a group. Does that make sense to everyone? Any questions? Okay, let's do it. Can I get your attention, please? It won't take long. You guys are really good at this. I have run this exercise with other groups, and it has not worked out this well, so thank you. Now, again, as I mentioned, we've kind of already gone through this generative and sort of refining process. Now, what we're going to do on your tables as a group, choose 3 of these challenges. Now, how you choose them is up to you. Are they the biggest challenges? Are they just the ones you hate the most? Are they the ones that consume the most resources? Discuss it and choose. You've got these clusters of problems in front of you now. You've got these themes that you know are emerging already. So of these clusters, what I'd like you to do is identify 3 challenges. Now, the next part's a little bit tricky, so I need your attention for just a moment. Somewhere on the table, there should be A4 pieces of paper. Probably covered up by now. Great. Has everyone got that? I'm pretty sure every table's got one. A stack of A4 paper. Right. Great. So once you've chosen, it's kind of a 2-part process, two-step process to this. You, as a group, identify 3 challenges that you want to move forward on, and then reframe those challenges in terms of a task and an obstacle. That's a little bit weird. All I ever really end up doing is writing, like I'd fold that A4 in half, I'd write task at the top, and I'd write obstacle halfway down, and then underneath that, depending on what the problem is, describe the thing you're trying to do when that problem emerges. I am trying to, I'm just thinking out loud here, but I'm trying to provide support to a practice manager who is just not interested in it. My challenge is having them understand I can actually help them. So the task would be trying to provide support, and the obstacle would be someone not thinking they actually need my help. It's a very simplified example, but does that make sense? Okay, so there's a little bit more discussion here. What we're kind of trying to hurry up is I don't want to hold you up from morning tea. Afternoon tea, yeah. Such is my sense of time, obviously. So we'll go through it quite quickly. And then what we're going to do is, as a room, we're going to start pinning these things up on the wall. So we've probably got like another 10 or 15 minutes to go if we move pretty quickly. So first step, figure out which 3 you want to move forward with, and then write up those task, obstacle, reframe them as task and obstacles. You can start to see we've got a lot of problems, and you can start to get an idea of how this sort of works. Themes emerge. Once you start writing stuff down and start discussing it, themes and concepts and commonalities start to emerge. Now, what we're going to do next is effectively the same thing that we did here in the tables, but as a whole room. It's going to be a bit of a challenge because there's quite a few of us and there's only one mic, but we'll figure it out. So what I would like then is one table to read out to the room one of the obstacles they identified. Who wants to do that? You've got 2 to 3? Yeah, thank you very much.
Just one?
Yeah, just one.
What do we want to do? This one? Change? So one of our topics was change. So our task was trying to affect change within an organisation with respect to processes and outcomes and improvement. The obstacle that we had written down was an entrenched sort of cultural belief, entrenched behaviour patterns, and kind of a herd mentality from a large group, trying to affect change in that large group.
Great. Thank you. I'll grab this now. Did you all heard that, right? How many of you got a similar? Any table's got a similar problem? Okay, so bring it on up. I've got one as well. Bring it up. We're doing the same thing. We're doing clustering again.
Thanks for interpreting my gobbledygook. You did very well.
Okay.
Related to, yeah.
Okay, another table and another problem. You got the same one? Something similar? Anything similar to this problem? Okay, great. New table, new problem. Who's going next?
So we've got like an internal PHN one. So the task that we have is PHN teams communicating and collaborating across programs. And the obstacle that we have is teams working in silos or having only an internal team focus as opposed to an organisation focus.
Wonderful, thank you. Yeah, you want to put that up now. Who's got something similar? Anyone? Similar? Yeah, 1, 2. Anything else? Okay, so we're going to put these up in a way that we can read them. So try and sort of keep them eye level. Yeah, thank you very much. Okay, new table, new problem.
GPs or allied health professionals or nurses, and it's very frustrating and we don't know what to do. So our our task is to get good attendance at the events and workshops that we host, and our obstacles are no-shows despite plenty of registrations, competition between a lot of other events. For example, GPs will say, look, we could go to something every night, why should we go to yours? And no financial incentives for GPs, for example, to attend our events despite the fact that they are free. Yeah. Yep. Yeah, allied health, nursing.
Okay, anything similar? Doesn't have to be identical, but a similar problem. No, got a unique one here. Similar? Yeah, no doubt. So this is a great point, actually. There is a lot of overlap and commonality here. Each table has done their own refinement. So, you know, it's absolutely okay that you may well have identified the same problem. In fact, you probably have, somewhere down in this wonderful mess. What we're talking about now, though, is the ones that you've chosen to promote, to take forward. So you can start to see that there's going to be clustering here. I mean, already, this has got a lot more attention than some of these other ones. Doesn't mean it's a bigger problem. It just means that as a group, we're starting to tend towards that one. And don't forget, this is all a bit of an approximation. Normally, we would be doing this over weeks, not minutes. So don't worry too much about how right we're getting it. So another table and another problem.
The task is staff capacity expectations, so us as PHN staff, and the obstacles, funding, distance, juggling multiple projects.
Great, thank you. So staff capacity and having to juggle multiple projects, money, distance, similar problems. Got one here, another one, great. Okay, let's keep going. Another table, another problem. We kind of run out. You guys? Yeah?
So our task was, we talked about meaningful engagement. So we decided that there are too many choices, programs, incentives, conflicting priorities for the clinics out there.
Thank you. Too many choices, too many programs, conflicting priorities. Who's got something similar? Yeah, great. Thank you. Anything else in a similar space? Again, it's not going to be identical, but are you talking about the same task or the same problem? Great. Okay, let's keep going. Who's next? You're out? Every table's out. Okay, here we go. There's one here.
We had a funding one, so our task is trying to affect change in practice models of care, and the obstacle around that is the funding is tied to fixed Commonwealth models and structures.
Right, so funding models and structures, similar, unique? Okay, let's keep going through the rest of them then. Yep, one more. You know you guys are going to have to go through all of yours as well, right?
So we had general practice engagement support as our task, and our obstacle was trying to change the expectations of general practice. So things like not funded as before, limited staff, grieving for past support.
That's good. Okay, is there anything similar? Yep, great. Past that. Thank you. Thanks, man. There's one more. Okay, let's go through the rest. Okay, so we're coming now to some of the more unique ones. Okay, great.
I can't spell. So ours is sharing data, so that's the task. The obstacle was mistrust, big brother, and security.
Thank you. Yeah, I'll take it. Does anybody else have anything around sharing data and information as a challenge? Okay. Now, just because it doesn't have anything similar doesn't mean it's not a big problem. I just want to be very clear that this is not a metric for measuring problems, but it is somewhat of a measure of where our attention as a sector or as a community are going. So there must be a couple more left. Yep.
We had ensure a consistent messaging across the PHN as a task, and an obstacle was lack of strategic direction and or primary healthcare knowledge in the staff. So they could be new or they just have no idea about health.
And any others? Yep.
So our task was having an effective CRM system, and the obstacle... So our obstacle was knowing what to put in, knowing what we want, but basically no perfect system exists.
Yeah. Thank you. Are there any other task obstacle sheets kicking around? Is there one? Okay. Thanks, man. Thank you.
We had reporting just at the goalposts. Sorry, so our task was reporting, and obstacles were the goalposts keep moving. There's changes in the health landscape, literacy, and the length and KPIs and bits and pieces like that.
Unclear goals, a problem everywhere. Thank you. Okay, so let's wrap it up. Any more? I'm just going to grab them now if there are, and we'll put them up. Okay, now the next part's going to be a little bit interesting. Have a look over here. What we've got, and I need to make sure that I understand this myself. We've got a cluster here, and these are the independent ones, is that right? No, yeah, that's fine. Okay, so what we're going to do next, because we're a little bit over time and I do know you guys need to get tea, coffee and the rest of it, we are going to leave the room this way, and as you file past here, you'll see these little slips of blue dot or colored dots. They're not all blue. 3, so you get 3 each, and you can distribute them however you want. If this problem is one that really matters to you and you care deeply about it, then put all 3 of your dots right on here. Try not to cover up too much of the writing. If it turns out that one is really popular and it turns out we can't read what the problem was underneath, that would kind of suck. But again, if you want to distribute your votes, if you like, across 3 different ones, you can. So that's what we're going to do. So what we'll end up with, of course, is kind of a heat map of, again, where our kind of concern and consideration is going to go for the next round. When we come back in, we're going to be exploring solutions to some of these problems. Not all of them, because we don't have time, but to the top 3, 2 or 3 that we identify. So the way this is probably going to work is if we kind of form a loose line around this way, and as you come past here, grab one of these, take a moment to look through these problems. Hopefully you're kind of remembering which ones matter to you, and then place your votes accordingly. Does it make sense? Any questions about that? Right, let's do it. Okay, you guys are in fast. Now what we're going to be doing is much more fun and much more uncomfortable. We're going to be generating solutions now. We're going to follow the same process, generating and then refining, generating, synthesizing, divergent, convergent. That's all designers do. Now, we've seen some very clear themes emerging. You guys have been part of the process. So what we've done now is we've reframed these issues that have emerged. Something that we like to ask ourselves is, how might we? It's a relatively simple technique, but it's very effective. You take the problem that you're facing and you frame it as a how might we question. And the power here is really in the word might. It's not how will we, it's not how can we, and it's certainly not how should we. Those are killers for innovation, at least to begin with. They're legitimate questions, but they're not as interesting as how might we. So what we've done in the break is we've taken 3 of the clearest obstacles that are being faced, and we've turned them into these statements. These are very broad, which gives you a lot of room to move in this idea of generating solutions, which is coming up next. So for those people that have just joined us, we're reframing the top 3 problems that we've seen over here as these how might we statements. How might we, it gives you the right to go very wide, because it's just might. So how might we better set and communicate goals as a team? Now, it's up to you to define team. Is team the entire community you're working with? Is team the people who work right next to you? Again, that's up to you. These are very broad problem statements, but there's nothing wrong with that. How might we make it easier to create real change and innovation? Real change. Easy to talk about change, harder to actually make it happen on the ground, much harder. And how might we increase engagement from practices? Now, you all understand these problems pretty well. Not least of all because they've come from you. You may have your own particular take on it, and that's absolutely fine. So what we're going to do next will probably be the least comfortable part of this, but that's going to be fine. We're going to start sketching out solutions, and we're going to use a process. It's often called Crazy 8s, and you'll see why. It is going to last 8 minutes, and I'm going to be really strict on this. And you'll see why in a moment. But first of all, I'd like each person to grab an A4 sheet of paper. Should be a fresh pile on the tables in front of you. And we're going to follow this little set of this diagram here to make 8 panels on one piece of paper. So fold it in half lengthwise, fold that in half, and then fold that in half. And when you open it up, you'll have something that looks a little bit like step 5 here. I wish. Right, everyone got that? They're small, they're teeny little squares, but you'll have 8 of them. That may not be as easy for you to work with. Yeah, wonderful. Do you mind if I hold this up? You're aiming for this, okay? You're aiming for 8 little pieces of paper, effectively. Wonderful. Okay, has everyone got that? This is the easy part. Everyone got them? Okay. You're going to want to pay attention to this next step. You are going to want to pay attention to this. Your goal, guys, we just don't have too much time, so your goal is to create 8 solutions. Now, before we move forward, I'll take you back here. Well, let me finish this off. Each one of those squares is going to have a different solution to one problem in it, and we'll step back to the problem so you can refresh your memories. But your goal here then is 1 minute, 1 solution. The first solution you think of will be the one that occurs to you most readily, obviously. You'll probably come up with 3 or 4 really common, ready-at-hand solutions, probably stuff you've already done or tried to do, and then you're going to run out of ideas. And you're going to keep going. So the last 4 or 5 ideas that you put down, they might be rubbish. But that's okay. But the goal here is 8. Don't stop until you get 8. If you have to have 8 bad ideas, perfect. Absolutely perfect. 1 good idea doesn't count. Doesn't count at all. You must get 8. Now we do this to push ourselves, and it is uncomfortable. Remember I mentioned I'm a little bit comfortable doing this, but I still don't like this part that much. So use stick figures, use words, often you might need to, and I'll give you a little example here. It'll look like this. Thumbnail sketches. Now the thing to remember here is it's just for you. You're not going to share this with anyone. We're not going to collect these. This is pushing your own thinking. So we're going in a minute to kick off, 8 solutions in 8 minutes, and the goal here is to go as wide as you can. So don't be afraid about being ridiculous. I mean, you're going to have to be ridiculous in order to finish it. Got a question? Okay. So first of all, just to make sure that we're clear on the process, right? Okay. Perfect question. It is 1 idea. Which one is up to you? But only 1. It's hard. This is hard to do. You're going to take one of these things and you're going to think of 8 possible solutions for them. But it can also be fun. The thing about this, it's called Crazy 8s because it's a mental process. It's you're going to move fast and make it fun and don't overthink it. So, has everyone got the problem they want to focus on? Yeah? Okay. Go. I'm going to say, you guys are really good at this. Normally, by 4 minutes in, there's just panic sets in. Not here. It's really good. So, what you've got in front of you then is 8 ideas of a range of randomness and craziness. Some of them, no doubt, are feasible. Some of them, possibly not feasible. What we often find when we're doing this sort of in a more professional setting is even the lunatic ideas that can't possibly be done have a grain of something interesting in them. And it's looking for that kind of grain of interest. That is what we start to do. So this generative exercise is literally about generating as many ideas as possible. So you give yourself some options, which is what you've just done. You've given yourself some options for what comes next. And what comes next is refining one of those ideas. So take one of them. Use a single sheet of paper this time. So this is one idea on a whole sheet of A4 paper. But just let me go through what you're going to do. One idea, A4. This is about adding detail. This is going to be about communicating your idea. And I'm going to show you an example in a moment. It's a similar level of fidelity. It's fine to use thumbnail sketches. It's fine to use stick figures. It's fine to write it out if you need to. But this is where you choose one of the ideas that you've had and you flesh it out. We've got 10 minutes. I'm going to try and bring it down to about 8 minutes. We'll see how we go. Now you can describe a process, which is often very helpful. The beginning and the middle and the end. If, for example, you were perhaps designing a tool, a specific tool, you might have a single state. You know, very often this type of process is used to help people think about digital solutions to stuff. Not the most interesting thing in the world, perhaps. So very often people are sketching out apps or a website. But I've seen people do this and sketch out, you know, ideas for engines and mechanics and things like that. But you're also welcome to write it down. If you are writing it down, I would encourage you to sort of think about this beginning, middle, and end state, if possible. It's a little random, I understand, but here are a couple of examples to give you an idea of this. On the left is one that somebody's drawn out using a kind of beginning, middle, and end. There's a bit of a flow there. Don't worry about what it actually is. It's not going to make any sense to you. It doesn't make any sense to me anymore. It's ages ago. And on the right-hand side is a more detailed single state. You've got enough time, though, to do this level of annotation. You see the notes around the edge? To help people understand, now these ones we are going to collect. These are the really interesting ones, right? Because now we're starting to boil stuff down. So, 10 minutes, more or less, to take one of your ideas and flesh it out to the degree that somebody else would stand a pretty good chance of understanding what you're on about. It doesn't hurt to write the problem that you're tackling at the top, but it's not critical. Remember, you want to go back to the how might we? All right. We'll step back to, here we go. So we had setting and communicating goals as a team. So figuring out what we're going to do and then making sure that we have that shared understanding. Making it easy to actually create the kind of real world change that you want or the innovation that I know you're being asked to come up with. And getting increased engagement from the practices that you work with. So you've got 8 ideas around one of these problems. Choose one of them. Use a single sheet of paper to flesh it out. Well, just so you know what's coming, we're going to present these ideas back to the table. Right? So you're going to need to talk to these. Talk about these ideas to other people. So we'll start now, 9-10 minutes. What you've all got then is you've got one idea each. We're going to take a little bit of time now to present these ideas, and I know you've already been talking about them, which is great. Each person will sort of introduce or present, talk about their idea with the table. It will take about 10 minutes to do that. We're going to, a little bit longer maybe. And then each table is going to choose one idea. Okay? You're going to choose one idea to put forward. But a couple of points to note here. Guys, a couple of points to note. Thank you. I would really like to collect all of those ideas. So it's true that each table is only going to promote one idea because of time, basically. But I'd love to keep them all. So don't throw them away. Don't take them with you. Please leave them on the table. Okay? This is going to be really interesting. But you will be choosing one idea and promoting it. Now, here's what's important. Please make sure that everybody does understand and can talk to the idea that you choose to promote as a table. Okay? You're not going to talk about it for a long time or anything, but you will need to be able to describe it, because the person who reads that back out to the room isn't going to be the person who wrote the idea. Okay? So 10 minutes, discussion and selection. Who's going to go first? One table, one idea. Okay, fantastic. Now, first of all, can I ask which idea it is, which problem are you tackling?
The first one.
Great. Come up here. And everybody else, who else has tackled this problem? Yeah? Okay. Can one person from each of these tables stand up and come over here? We're going to go through this really quickly. So there's going to be a line of us. We're going to present the ideas according to the problem that we're tackling, and then we're going to move on. So line up over here. You get to go first. And I'm going to need everyone's attention for this, Because this is the part where, as a community, you've thought of the problems, you've chosen problems that matter, you've thought of solutions individually and presented them back to groups, and now finally, again, as a community, we get to hear what these ideas are. So this is the part that really matters. This is what it all comes down to. So I'd ask you to pay attention to each person who's speaking.
Okay, so we talked about the idea of having a shared solution to a problem. So initially we're talking about having an internal communication to everyone involved around what the problem is, what we're trying to achieve, and what activities we're going to be undertaking. We use the idea of rolling out a new, some sort of new software or some sort of new tool in a practice. So we thought we need to get everyone involved, or everyone who has some sort of involvement with this, to be comfortable and competent with this new tool, so that they're able to promote to their various networks in a way that is reflective of their area of work. So whether it's population health or planning or whatever it is, so that they can have that discussion across their networks. And then talking about how do we roll it out across those networks. So engaging other people that may have those marketing and communication skills, other people who have skills in engaging practices, so that we can benefit from their knowledge and their ideas around how we engage with multiple networks. And then from that, we can utilise champions, vocal people who have been the early adopters, so that they can help to pull other people along where we may not be able to reach everyone.
Great, thanks, Liam. I'll take that. Great ideas there. I really like the idea of bringing in other people that have got like skills in communication, maybe from outside your immediate sector, to help out with that. And of course, identifying champions and advocates is a good way of going. Yeah, would you like to go next?
Yeah.
Thank you.
Yep. So ours, we were talking also about better setting and communicating goals as a team, and our discussion was around within the organisation. Everyone at the moment's working on activity plans, etc. So back to basics. Within each team, we meet, discuss what our activities are going to be. That then is presented to all the organisation's teams, who give their input into whatever those activities, so that we're not duplicating activities, we're not, and we get the input, everybody's ideas in the whole organisation, and as well as that, the organisation as a whole knows what everybody's doing.
I really like the idea of shared understanding as part of that. And I am a little cautious of aware of time here, so the briefer the description, I'm afraid to say, the better.
I can be brief. So we talked better set of communication goals as a team, and the team we chose was the PHN. So at the moment, the messages come from the exec to each programme area, sort of down. That's the right term. Down, and the PCLOs who are meant to be delivering the messages kind of only hear it from their exec stream down. So to go from silos to integrated planning and be involved in the discussion rather than being told after we need to move to the zoop, where the PCLOs are right at the middle. They attend each other programme areas meeting on a rotating basis and then take back what's happening back to their teams, but they also have input into those decisions before they're made and passed on to them to deliver.
Thank you very much. And a round of applause for everyone, yeah? So some great ideas about better communicating goals, setting goals and working as a team. I'd like now everyone who has got solutions for this space here, this idea of really implementing the change that we talk about. 1, 2, fantastic. Over to you.
Thank you. You don't know my superpower that I wish I had. I wish I could disappear right now. It's okay. So this great idea came from Jane from Wentwest. The idea is she chose to actually use data and measuring data as her way of the change in innovation in practice. In the start, it's to identify the current state of the practice, so where are they at, to know their data, and to look at why they want to actually make the change. The next step is to look at their systems. Do they have data extraction tools? The how is about gaining consensus in the practice about where they start, so make that a team decision. The next step, kind of the middle part of it, is about an innovative hub where they decide to do things a bit differently. So to ignore the constraints of, what they think they can't do, it's about putting their wish list together and thinking outside the box. From that list, then they refine that information into an implementation plan. They communicate that with the team, and then they share that information, and there's transparency in the data that, is this right, Jane, in the data? And then in the end, they evaluate what they've done. So.
That's great, thank you.
Have that. Do you want that first?
Yes, please. I might ask you if you would mind putting it up just here. Thank you very much. Pass this over to you.
So generally, the solution for mine was really valuing the ideas and the knowledge at all levels of the PHN organisation. And to do that, there has to be transparency at the beginning around what the Department of Health requirements are in the planning process, also what funds are available. So once everyone knows what they're working with, and then people can throw up ideas within portfolios, but then the whole organisation comes together as a team and discusses those innovative ideas and then goes back and plans together, and that's all supported as an organisation.
So we were looking at combining ideas and thinking and manpower to tackle one idea and do it well. So when we're looking at activity work plans now for the PHN, so limited access to dollars, but still a high number of priority areas for PHNs requires pooling of ideas and resources across teams and portfolios. So instead of tackling 20 different main programs, immunisation, cancer screening, Aboriginal health as separate things, and they all have 20 or so activities under them, choosing 5 ideas as a collective group, pooling funds and prioritising tasks that can cross off more than one priority area at a time, so saving manpower, dollars and refocusing energy.
And again, a round of applause, some great ideas here. Okay, and the last problem space. We're looking at increasing engagement in practices. Anybody tackle this one? Yeah, wonderful.
So we chose how does engagement with PHN add value, so that when we're going out to practices that we need to be creative, when we're identifying practice needs, so what the practice actually wants, what they need, being adaptable to those things, delivering up-to-date, current best practice, advice, providing experienced, knowledgeable staff. We had lots of kind of dot points. So. Providing short, sharp, clear messages, and then using small steps, achievable short activities, and that's probably about it.
Wonderful. Thank you very much. Cheers. Could I ask you to take them up just here? Okay. Thank you.
We chose finding a WIFM activity, so what's in it for me for the practice, and a what's in it for me resource, and what's in it for me for this data program. We did the beginning, middle and end type strategy. So we thought first of all would be to research the practices, know their culture, their people, their staff, their demographics, their data trends, like really get to know who your target is and how you're going to tackle conversations and information. In the middle, we would then, from that information, develop, design and have resources, training, support that they value, not just what we want to hand out thanks to the government, that the actual practice wants it. We actually make it person-centred, so it might be an individual within the practice, or it might be a whole of practice sense of value. And in the end, we would look at, you know, developing strong relationships, valued resources, value time spent with the PHN, and they would engage better with our data program. A good example was in Cairns. We started with hardly anybody on the data program. Now we're at 70% capacity using the data program and using it well. And one of the ways which we found getting into practice that sort of have the shutters down was actually bring the coffee. Rock up and ask them, how do you like your coffee? I'm on my way.
I like that a lot. Thank you. A round of applause. Okay, well, thank you guys. I'm really impressed. We're wrapping up on more or less on time. Just so you understand what you've done, ordinarily this would take a week. So you've done in a little under 3 hours what people like me would sit around and spend a week doing easily, if not longer. So I know it's not comfortable, but it's kind of a bit of a sprint through my world. And I hope you found it interesting. I've found it very interesting, and I've really liked the ideas that have emerged from it. So I'll hand over now for a bit of a wrap-up. But you do have the chance to vote. Do you want to vote on these ideas? No. Okay. To what end? So, okay, fantastic question. What happens next is, I mean, we already have a fairly good idea of these ideas that have sort of floated to the surface. So perhaps there's no need to vote on them specifically. Ordinarily, that's what we would do, though there is a lot of us. And the end would be being able to choose which of these solutions to start to explore more. Some of them are seemingly difficult to implement, but we know that within them is a solid idea. So what we do now is we take these solutions down off the wall, and don't forget, we also collect your individual ones. So there's quite a spread that we get to look at, and then we identify what about each of them has got value, and how do we start moving forward through them. So the idea here definitely is that APNA is going to take these ideas and start figuring out how we can begin implementing them. So does that change anyone's desire to vote? No, fantastic. Well, that's an easy wrap up then. Thank you, guys.
Thank you. That was absolutely fantastic, a great end to an awesome day. We've had a great lineup of presenters today, but thank you, because I think that really pulled out, and I know that it helped me as a PHN person to be able to say, well, the force in this room is amazing and the knowledge in this room is amazing. I think we need to continue to embrace that and lean on one another, because there was some brilliant ideas up there that I've gone, oh, that hadn't thought about that. So I think if we have the ability to continue these discussions in our PHN Network forum, if you feel you're not part of that, please contact Murphy Wood in the office, and she can certainly pop you on that list. I have had a couple of people ask me, oh, have I fallen off that list? No, you haven't. Just with the intense activity in APNA over the last few months, it just hasn't been a priority to schedule that. Just with everything else, we've had some staff changes, but it certainly hasn't fallen off our agenda, so we haven't forgotten about you. So it will happen. A couple of little things to wrap up. Us at APNA, knowing that you are the touch point, again, like I alluded to before, to our members, we have some really great tools which helps to engage particularly new nurses that perhaps don't know about APNA, don't know about what we do. There's some fantastic packs that we can also send out, which is, it's sort of like an easy opener to a conversation when you're out there in practice. Again, Murphy can arrange to send these out. There's some great new initiatives, if you don't know about it, our professional indemnity insurance that can be an optional part of membership for nurses, which is fantastic, great value. Read up about it, it's really good. The online learning and all the other benefits that APNA offer our members.